day, everyone. We're happy to have you join us and yet again another webinar of the Yaba Voice. This is a very, very, very special month to us. I'm going to tell you about it as we go on in the course of the discussion today. But please, if you know somebody that needs to be here. All right, so I was just challenged this morning that, oh, Yaba Voice, what are you doing? And I said, oh, the flyers are there. And it said, what is Enuresis? Please help me tell them. That simply means bed wetting. So please, if you know somebody that needs to be here, just keep telling them that what we're talking about today is bed wetting. It's just bed wetting. Sorry, we're so sorry about that big grammar that we were just peering all over the faces there. Also, please, bed wetting, that's what we're talking about. So if you know somebody that needs to be here, somebody that needs to hear this, somebody that needs to be part of this platform today, please help us say the word to them that what we're talking about today is bed wetting. Enuresis, the psychological causes, as well as what are the solutions, what are the preventive measures that we will be talking about. All right, so like I said, you're welcome to yet another episode of the Yaba Voice webinar. We're happy to have you join us today. Before we go on in the discussion, the medical director is here on the platform to formally welcome us to yet another episode of the webinar. Dr. Lubenga Adekile Oweye, over to you, sir.
Good afternoon, everyone. I welcome you to today's edition of our regular webinar by Yaba Voice on mental health issues. Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a platform of Federal Neuropsychiatric Hospital, Lagos, through which the hospital creates awareness and educates populace on mental health issues. Today's topic is Enuresis, psychological causes and intervention. As we all know, Enuresis is more commonly known as bedwetting. And this could occur either during the day or at night. And when it occurs at night, it is called nocturnal enuresis, and is the most common type of the disorder. Daytime wetting is called diurnal enuresis. Some children experience either or a combination of both. This behavior may or may not be purposeful, and the condition is not diagnosed until the child is 5 years or older. In today's webinar, the following questions will be answered. What do we understand by enuresis? What are the causes or risk factors associated with enuresis? How do we recognize this problem early? What are the available solutions to it? Or is enuresis preventable at all? To do justice to today's topic are assistant experts in mental health issues. In the house, we have Dr. Grace Tumitayo Ijarobe, a chief consultant psychiatrist, special grade 1, an internationally certified addiction professional, and the head of Children and Adolescent Mental Health Services Center of the Federal Neuropsychiatric Hospital, Yaba, Lagos. She is a fellow of the National Postgraduate Medical College of Nigeria, a member of the West African College of Physicians. She also holds masters in child and adolescent mental health from the Premier University of Ibadan. Is a master trainer in substance use disorder of the Colombo Universal Treatment Curriculum on Drug Abuse Treatment in Children and Adolescents. The second speaker in today's program is Dr. Olaniwaju Sodende. Dr. Olaniwaju Sodende is a clinical and forensic psychologist and psychotherapist. She is an assistant director of clinical psychology at the Neuropsychiatric Hospital, Aro, Abeokuta, Nigeria. Dr. Sodende attended the prestigious University of Ibadan for his Bachelor of Science degree in psychology. He also has Masters of Science in clinical psychology and PhD in clinical and forensic psychologists. Dr. Sodende is certified by the Nigerian Association of Clinical Psychologists and the Albert Ellis Institute, New York, United States of America Center for Rational and Cognitive Therapies, as well as the United Nations Office of Drug and Crime. He has attended and presented papers at several local and international conferences and scientific workshops. He is currently the chairman of the Nigerian Psychological Association and the Nigerian Association of Clinical Psychologists in Ogun State, and is a fellow of the Nigerian Association of Clinical Psychology. Dr. Sodende has several publications in peer-reviewed journals and chapters in many textbooks. He is happily married to Princess Oluwakemi Sodende and blessed with 3 adorable children. Ladies and gentlemen, kindly relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Thank you and God bless.
Thank you so very much, our efficient, energizing, and very dynamic medical director. Is so passionate about this, ensuring that the right information is passed across to members of the public. And that is more like just doing our own quota in ensuring that people are well informed. We destigmatize mental health as much as possible, and then we also provide access to people. And you know, one of the beautiful things about today's webinar, I don't want to tell you, is like it's hot out there, but it's so chilly because it's made this place very, very comfortable for us. Kudos to you, medical director, sir. We celebrate you so, so very much. And this is very, very good. Okay, so today, like I said, it's a very special day to us. Very special day to us at Yaba Voice. Please don't leave until the end because there is a breaking news. I want you to be just part of the breaking news, so you're going to hear it first from us. But this month is very special to us here at Yaba Voice. And so today we'll be having what we call Enuresis bedwetting. Like I said, please, if you know somebody that needs to be here to receive this information firsthand, please let them know that we had started. We are also streaming live on the Facebook too. So you could go to the Facebook page of Yaba Voice, one word. We're there on Facebook, and then you can also join us live on this webinar today. And like the medical director has introduced, we have seasoned experts who will be talking to us on what we call Enuresis bedwetting. I don't know how many people that will be willing to confess, but send the prompt to Luakem. Okay, all right, so we're sorry about that network. I think that's a bit of technical itch, but we are back again. Okay, so Dr. Ijaribe will start this discussion for us, and she'll be talking to us about what is enuresis and what are the subtypes that we have. What is enuresis and what are the subtypes of enuresis, or the different types of enuresis that we have. Over to you, Dr. Ijaribe.
Okay, so good afternoon, everyone out there. It's really a pleasure to be in your midst again. A pleasure to be in your midst again. And my name is Grace Ijarobe, and today I'll be talking to you about enuresis. So just like the earlier presenter told you, it simply means bedwetting. The big terminology there is bedwetting. And bedwetting is something that we know that many children have, both in our environment and out there, worldwide. Enuresis is known. This is a condition that starts in childhood. So let me quickly say that enuresis is not when the child has a condition that, automatically would make the child, urinate on self or urinate in inappropriate places. That is not enuresis. Enuresis is when the child urinates inappropriately on himself instead of going out to urinate in appropriate places, in some kind of subconscious state, whether during sleep, during the night, which we call nocturnal enuresis, or during sleep during the day, which we call diurnal enuresis. So some form of subconscious state will make the child not to get up, not have an awareness that the bladder is full and to go out and urinate. Now, for those ones that are medically induced or that have other causes aside from this core two that we call enuresis, it could be that the child have maybe some congenital problems, some problems that are birth defects of the bladder, or the child has mental impairment, or we call disability, and therefore cannot understand the concept of going to appropriate places to go and urinate or finding his way around to the appropriate places. So those may not fall under enuresis because there's something causing that. If it's due to something like urinary tract infection, one that is making the child have incontinence, incapacity to be able to control the bladder for a while, that may not necessarily fall under enuresis. So enuresis is something that is persistent, something that recurs again and again. The child goes to bed and bedwets. It's not something that occurs once in a while. We have what you call primary and secondary. So in primary enuresis, the child does not stop bedwetting right from birth. When children are born, we buy all these pampers and we use it up to a point when we begin to toilet train, maybe about 2 years of life. And after a while of toilet training, waking the child up at night, the child learns to wake up at night to go and urinate by himself or herself. So if this is not achieved, that is primary enuresis. So the child can go on to 6, 7, 8, 10 years of life, 12, 15, 18, even into adulthood, and may not stop bedwetting. So every night or every other night when the child sleeps or when the individual sleeps, the individual will pass urine on self during that temporary low conscious state. Also, it's possible that individuals who have what we call other conditions that can cause this urine to occur during the subconscious state can seem to be bedwetting. And it's until they come to clinical attention and investigations are done that we'll find out that this is not bedwetting actually, that this is a condition that the child has that is treatable. And after treating that condition, the bedwetting will stop. For instance, if a child has seizures, sometimes during episodes of seizures, the child can have what we call urinary incontinence and pass urine. We also know that seizures tend to occur mainly at night when the child has a lower subconscious level. So if the child has seizure during sleep, the child will not be conscious enough to get up to go and pass urine. And therefore the incontinence during that seizure will make the child to bedwet. And so sometimes the first time we get to know that the child has a seizure is when this bedwetting does not stop or appears out of nowhere, and is disturbing the whole family. So there's so many things that can cause bedwetting, and there's so many different types of it, depending on the way it's occurring. We are able to sort out what is what based on when is occurring, how is occurring, and who this child is, the conditions the child has, and how the family is. Many family dynamics can make a child to bedwet. We've gotten a child before. The reason the child was bedwetting was because the toilet is outdoors, some few miles away, and the child is scared to go out at night to go and urinate. So he just manages himself on his bed and urinates on his bed. And the only thing to solve there was making sure that there is some kind of convenience, even if it's a potty, near this 7-year-old child, 8-year-old child, so that child does not have to go out at night, since the child is so scared of going out alone in the dark at night. So many things can make children or individuals to bedwet, which we have to sit up and actually look at. In terms of psychological and emotional problems, Individuals who have emotional problems can bedwet, and that brings us to the secondary enuresis. So often when an individual has stopped bedwetting after the toilet training at 3, 4 years of life, 5 years of life, we have that after a period of dryness, this person may then suddenly start bedwetting. Every other night, the person is urinating on the bed. And of course, in our African context, a lot of people will say this is jazz, this is witchcraft, inflicted or afflicted the child and all that, or this individual. But sometimes it's emotional distress. A child who is being abused at home, either by parents, especially by parents, if the core character that should protect the child at home becomes very ferocious at home and is, all out and beating this child anyhow, the child becomes very fearful of this protective figure and therefore may begin to bedwet. So after a disappearance period of this bedwet, it may start again. If there is also abuse from outside, child is being bullied in school, or there are other individuals outside the home that are bullying the child, threatening the child, that perceived threat to life, threat to comfort, threat to bonding and all that is enough to make the child begin to urinate, have nightmares. When we're all growing up, many people that were bedwetting, we have this dream that, as we were walking up by the river, they just pulled down their panties and they started urinating. And then they wake up and then there's bed all over the bed. Okay, so they have started with these nightmares and all that, that will, usher in this period of bedwetting. It's not a nice dream, it's actually a nightmare. So children who have emotional distress, sometimes the call to that emotional distress, the attention we get first to emotional distress is the secondary enuresis, the return to enuresis by that child after a period of abstinence from enuresis. In our environment, in our core environment, there's a way we toilet train our children. And that is by, some mothers don't have that patience. When they're toilet training the child, they just approach the child and give some hard knock and beating, get up, get up, get up, go and urinate, because they don't want the child to flounder and all that before waking up. They don't have the time. And so the child gets used to what we call high pressure of stimulus to get up from bed. And the pressure for bladder stimulation is lower than that. So if the child has bladder stimulation, it's not enough to wake the child up, because the child is used to waking up with high thresholds of painful stimulus from beating. So it's advisable that, when people are actually training the children, they should, call them out. If you want to get the child up to go and urinate, you call and say, Tolu, call her, get up, So let them have a low threshold for wake up, so that the high threshold for wake up will not introduce problems to them later on. Let me take it over to them.
Thank you so very much, Dr. Idarugbe, for that. No, she had mentioned so many things, but I don't think she mentioned some of the things that happened to us then. No. In those days, when you want to wake up in the middle of the night and you look at, and everywhere is dark, the first thing that comes to your mind is ojuju. That is what they had put in our mind. You just think of the ojuju, and literally, you don't even want to you don't want to stand up, you don't want to go and talk, you don't even want to dare open your eye. We will come down to all of these things when it comes to prevention and how to help children deal with bedwetting and other things like that. Dr. Shodainde, let's look at, I know this thing that we're talking about is not just prone to children alone. I know that there are others too who just still bedwet. So what are the psychological, want you to break it down for us, the nitty gritty, what are the psychological causes of bedwetting, so that our viewers here today will be able to go home with something very, very important. What are the psychological causes of enuresis, both for children and adults?
Yeah, thank you very much, the presenter. I think Dr. Idarugbe has explained some psychological factors that, can predispose one to epilepsy. But additionally, I would just say, some psychological factor when it comes to primary enuresis, which is bedwetting. Apart from the genetic factor, the general medical condition, which could be genetic, and other general medical conditions, seizure, diabetic, sleep apnea, and also some other disorder can predispose. Then most children, it becomes a problem when there are distress and impairment. The individual has what is called psychological pain, especially when it is an adult. The adult feels that, oh, I'm not supposed to be bedwetting at this point in time. So it becomes distressing to him. It's like a pain. This pain is psychological. The person might be having some regret, might be having feeling of worthlessness, even hopelessness, or even worthlessness, because some of these things are not intentional. So with respect to primary enuresis, the individual, generally has, never stopped. So this becomes very, very problematic. But when it comes to secondary enuresis, most people have already stopped bedwetting, but it comes over again. So when you look at the causes, psychologically, fear may be part of it, but as an adult, one will have expected that, okay, the individual outgrows the fear. Fear is a major factor during childhood. The fear of darkness, which is called nyctophobia. People are afraid of going out. And just like the presenter says about ojuju or whatever, because of what has been programmed inside the child as a youth, that maybe darkness, bad thing moves, during the dark, thieves, robbers, and a lot of other things, depending on the life event that the child has gone through. Then also adjustment problem, can call it adjusting to a new situation as a return in the normal routine of the child can also cause it. Traumatic or stressful life events, then inappropriate toilet training. I will pick them one by one. I've talked about the anxiety, which is talking about fear, especially fear of darkness, probably because of the film that the child has watched. There was a child that was referred to me, and I asked the parents that, does your child watch television? They say he watch television all the time. And there was a program, I can't remember now, that they said, the child normally watches. And I asked my children, because I've outgrown that age, and they said that film is very fearful that somebody will be disappearing. So that kind of anxiety, when the child now sleeps, the child will now be having nightmare. So, and that nightmare can also predispose one to anxiety, because if the child is supposed to wake up and go and, wee, then the child may not be able to go. They are adjusting to new house help. For example, most parents who have time to even toilet train their children, they give everything to, the house help or a caregiver. There was someone that was referred to me some years ago, and I asked the mother several questions, and the mother said, oh, let me call the house help. I don't know about this. So most people don't take time. So adjusting to new house help, maybe they are used to one house help and somebody else come, this can also predispose. These are adjusting to new house, adjusting to new school also can, or a new teacher in school. A teacher, they might be familiar with that teacher and relate very well with that teacher, but when that new teacher comes, it may generate some form of anxiety. Maybe the first one is caring, the second one is, is the one that, in quote, they shout, at them. There was a child that I see, and they said, describe, when we couldn't trace, I said, describe, draw a person for me. And when he drew the person, the hand was very big. And I was very particular, that was so special about this hand. I said, who is this person? He said, my teacher. Why is the hand so big? He said, that's the hand that the teacher used to beat. So adjusting to new home, adjusting to new teacher, all those things can cause predispose to, secondary enuresis. Then traumatic life events, a lot also relates to adjustment. Dysfunctional family, one family are fighting every time, excessive argument, and a disagreement about child training. A child might bedwet, and the father might say, okay, it doesn't matter. I bedwet when I was much more younger, but let's give him a time, we are growing. The mother will say, no, such things, conflicts in the home can result. Then lots of parents or close family relationship, divorce, separation, then also physical and sexual abuse can also predispose to a psychological factor. There was someone that was also referred to it. The neighbor was sneaking in while the parents were not around and was actually having sexual intimacy with the child, and the child could not tell the mother. And so the child regresses, and there were some bedwetting, and the mother was confused, and we say, that this child, what happened? And when we come to attention, and we asked, he said, there was a neighbor that was always coming. I said, why don't you tell your mom? He said, time I want to tell the mother will say, shut up. So inappropriate toilet training is also a major factor. Harsh toilet training, comparing a child with another, your brother, your sister is not bedwetting again, the next day neighbor is not bedwetting again, why will you be bedwetting? All these things can affect the child. And, excessive beating, caning. I had a client that said the father also used sometimes beating with cutlass in order to put fear. Sometimes they may say, we in the fire. And that kind of fire creates additional fear for the child. Then when the child is publicly ridiculed or shamed, there was a client that said, the father said he's going to carry the foam, to school, and the clothes that the child will wear on, and the child find it very ridiculous. So these are some of the psychological factors that can predispose to enuresis. I think I should pause here.
Thank you so very much. When he said cutlass, I just opened my mouth as in, how would somebody threaten a child with cutlass? And if you look at where we started from, Dr. Ijarubi had said, this is involuntary. This person is not in control. So it's not like they're doing it intentionally. I know that sometimes you're ashamed. I recall that then I wasn't able to go to family friend's house. When they say sleepover, that becomes a major problem, because in your mind, you would think of all the wee that would happen, and you now start saying, hey, God, this is my life passing in front of everybody would know. No, that is even traumatizing enough for the sufferer, not to not talk of hardening. I know maybe we would look at this core African beliefs and begin to look at, does it really work, or it further traumatizes a child? But before we go there, Dr. Ijarubi, are there risk factors that predispose? I know we have talked about the psychological causes, but are there peculiar things that makes an individual to fall victim of this? I know that there are some children. My first child didn't wee-wee, never wee-weed. The first time he did, and he said, oh, you wee-wee. He said, no, it must be water. He was so sure that he can never do it. But the second one, please don't ask me questions about that one. Are there particular things that makes a child to just go through this?
Okay, so children may be at risk of enuresis. Let's look at the primary enuresis first. Children may be at risk of primary enuresis if the toilet training was faulty. So if the toilet training was such that high threshold pain was usually used to wake the children from sleep to go and urinate, then the day the high threshold for pain is not there, the low threshold for urinating coming from the bladder will not be enough to wake that child up to go and urinate. So beating a child to wake them up is something that parents should try to avoid. Usually try to call your children to wake them up. Have enough patience to stand there. If you call a few more times, they will actually stare and wake up. So stand there and say, bimbo, 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 instead of putting your hand to their body, to their skin to beat them. Because once you do that, you elevate that threshold, and then it becomes, your toilet training may become more difficult. The other risk factors for primary enuresis, for instance, if the child has some kind of mental subnormality that nobody knows about, many children, you will not discover that they're intellectually disabled until they're maybe about school years, when you now see that they are not writing, why are they not, performing in class and all that. But earlier on, you would have thought that they had full intelligence. And so the difficulty with training them to become a continent of urine, you would have attributed it to some other cause. And therefore, you would have said, this is bedwetting, this is enuresis. And honestly, one might have been taking adverse measures for the child. Another risk factor is change in care. Mother figures tend to change a lot these days. So there's a phase that's on board today, interacting with this child, and then an auntie comes in, the mother goes away, and then at times the mother goes away, is another house help, and all that. And so there's inconsistency in the way that the child is being trained through the primary period. And so that can make the child to persist in toilet training. Also, sometimes it's such that the environment may not be conducive. Where is the toilet bowl? If the toilet bowl is so tall and the child cannot climb, and it's difficult for a child to climb, usually children's toilet bowls are so that they can just, squat. So if that climbing that thing will make my sleep to disappear, the child may decide to have a little more sleep. And by doing that little more sleep, will bedwet before morning. So make sure that when you're toilet training, it's actually convenient for the child to go to the toilet and urinate at such times. Some children actually wet themselves during the day. They may be in the classroom, have a short sleep, and then they find that they wet themselves. And that is actually quite significant to us, because it tells us that the threshold for urination is actually very, 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 very high in those children, for them to just be sitting down and be bedwetting. So we may want to look for other things that have predisposed the children to wetting themselves. We may want to look for things like seizures. We may want to look at things like, even some other medical conditions, diabetes, hypertension. People believe that children don't have those kind of things. That are no, they are small children. But a child that needs to go to urinate 5-6 times during the night might decide after the third one not to get up again, because his sleep is constantly being disrupted. And so he may end up bedwetting. So if it's the night, that child needs to be screened, because the child might have, something quite important to pay attention to. We look at secondary enuresis, where, this urination on self is reappearing after a period of dryness. And this tends to occur more frequently in the teenage years. If the child is boarding out into school for the first time, the separation anxiety alone, the fact that they are going away from parents, loved ones, into a boarding house where they know nobody there, is enough for the child, to begin to bedwet at night. And the way that is handled will determine whether it will stop or not. Because if the child bedwets, it's not uncommon to find that, this child never bedwetted at home. So why is it that the child went to boarding house and started bedwetting? So before we label the witches and wizards as responsible, we could try and support the child a little more. Many of us, we are so drastic when we separate our children. If we're moving our home to another location, we discuss among ourselves, our husband and wife. We don't bother tell the children. So the children just wake up one day and they are packing up, and they are moving to another location. They've left all their friends behind. And that relocation, new environment, can predispose them to bedwetting. It's the same thing if they emerge into school. Have you taken the child to the school? Have you been talking to the child, you are going to go into boarding house, you are going to live with other people? Make it the child emerges in school one day, finds himself, he has about 20 bunks around him of strange faces, sleeps in. And unfortunately, the response of the community, the school community, may be shaming the child, which will only make it worse. It will increase the anxiety and fear in the child and make it worse. So anything that is life-threatening, anything that is threatening at all, can put the child at risk. Children who have gone through trauma, they escaped fire, they are survivors of accidents, survivors of banditry, kidnapping, may be rescued back home and may start bedwetting. So things that have emotionally tilted an individual, even an adult could start bedwetting after being rescued from a bandit camp, because the emotional trauma, the stress and everything that they have gone through, the living conditions in captivity when they were there, where they could not access anything. Coming back home, the environment is different, and all the changes and the refusal to accept that some things have happened to one in this adult stage may make them to actually sleep so deep that they bedwet. And people should not see it as something to crucify them for. It should be an indication for how fast do I support this individual. Urinary tract infection. Children can come down, or individuals can come down with bladder infection, and that may put them at risk for beginning to bedwet. Okay, so we should actually look for, once it's secondary and it's emerging, we need to look for medical causes of this and try and eliminate and treat it before we think this is psychological, and then we go ahead to treat the psychological causes.
Thank you so very much, Dr. Itarigbe. I know this is very germane to what we're talking about today, because if care is not taken, you will just think that everything is because the child does not want to get up. So, one thing I have gotten from what she has said today is the fact that sometimes it's not the fault of the child, because of the experience, because of the things that the child had gone through, because of so many factors that the child has no control over. It might make the child prone to enuresis or bedwetting, as we would call it. And so we must begin to be on the lookout. And one thing that is also passing across very strongly to me is the fact that, excuse me, when an individual goes through traumatic experiences, then the chances, the likelihood, the tendency to revert back into this condition is also there. And so we must begin to also watch out. And that forms part of what we begin to look out for, even as core professionals, people that are on this platform. And when we see them also as lay people, we don't begin to say, oh, the village people has come. There is no village people anywhere. It's just psychological. And then we are able to see how to get help and how to help the individual to be able to function as adequately as possible. And this is very, very important. Thank you so very much, Dr. Shodede, Dr. Jarigbe. Thank you for this knowledge that there are questions on the platform. Please, let's keep them coming, and we will take as much as we can as we go on in this discussion today. But then we're going to look at what are the psychological interventions? What can we do? What can we do to help individuals who bedwetting, who have problems with enuresis, or what you call, who have enuresis now, who have enuresis? So what can we do? How can we help them? Dr. Shodende.
Yeah, thank you, the presenter. The bedwetting, I mean, could be a very distressing and very ridiculous thing to the individual. And with the understanding, it's only people that are psychologically minded that we understand that, oh, this thing is not the fault of the child or the adult that is bedwetting. But the fact remains that when it is primary enuresis, when it is as a result of a general medical problem, or maybe epilepsy, for example, somebody came to our clinic in Aro, and while waiting at the medical record something, he just has a seizure there and foaming. Then by the time he comes, because we've already understand what what the person is going through, we just support so that the person can lay there well on the floor. And when they wake up, they are already will and also poo on the body. But the way we show love, care, and attention on that day really makes the person to be very happy, because at the end of the day, when they come around, they say thank you, they say thank you. So when it's primary enuresis and other these things, let's know that support by the family members and other people around are very, very important. This thing is not actually a spiritual thing, because many people attribute it to spiritual problem, that, no, it's the enemy that wants to shame us or whatever. No, it's not really. Some people have general medical problems. So some of the intervention is, apart from the support, the individual needs to see a medical personnel so that the individual can be properly assessed and the appropriate intervention medically can be carried on. But when it comes to secondary enuresis, somebody has been bedwetting before, and I've been experienced dryness for a long period and bedwetting again. So these two can be, distressing to the individual. There can be anxiety, fear, even going to sleep, of drinking water, of where to sleep, of going out, of visiting others, going for camping, going to the hostel, going far away from the family. Because this thing is not a personal shame to the individual, but a shame to the family member, because they feel that, oh, people see themselves as having failed in parenting because the child could not, stay bedwetting. So some things we do is to, there are associated negative thoughts. Hopelessness, helplessness, worthlessness, all these things are associated something. So we help the individual to re-education, psychoeducation, for example, and also cognitive restructuring to help the individual to see the individual in a better life, that no, there may be other causes. Then what also matters is immediate intervention. Apart from reassuring the individual, there is need for immediate intervention, because when the problem persists for long, the individual becomes used to it and can either develop phobia to it or accept it as a lifestyle. Then there is we train to limit fluid and water intake at night before going to bed. Then also before going to bed, the individual should need to visit the toilet and wee before going to sleep, because a full bladder, if there is a full bladder before going to sleep, this may result in bedwetting. Then there is what we call bladder control therapy, and this is combined with a relaxation exercise. What to do here is to help to train the individual to delay toilet visits. Most children are very playful. And in fact, when you are at a function, they can say, I want to wee-wee, I want to wee-wee 10 times, and they will get to the toilet and will not wee-wee. So when a child comes with this attitude, all one needs to do is exercise some patience. This form of bladder training helps to enlarge the bladder to hold more urine, so that the individual will be able to cope with the problem. Then reward for dryness. Most of the time, it's always beating, and blaming and ridicule and shame when they bedwet. But when they experience dryness, they also need to be commended, to say, well done, you'll be able to achieve 1 week today, well done. And when this thing passes, that positive reinforcement, encouragement can also help the individual as a form of intervention. Then there is what is called Enuresis alarm or bedwetting alarm. This is a form of device. I think it's sold from Jumia and other. This thing, it has been found to be effective. A device with sensor that make noise anytime there is contact with water. So when this is put under the child's bedsheet, and when the child is about, bedwetting, there is an alarm and the child wakes up. And the child would now associate the alarm to bedwetting. So even in their mind, will be conditioned that, okay, there will be an alarm. So anytime there is pressure, the child associated with the alarm, and go up, get up and go and wet in the toilet. So I think I should pause here.
Thank you so very much, Dr. Shodende, for that prevention. And I don't know, but there are some children that they will wake them up every time. Before you get there the next day, you have set yourself 2 a.m. you will wake them up. By 1:30 something, it's going to be like, pardon my Yoruba, as in the whole place is just damp. We will still come back, but I have questions here, and I want us to be able to take as much questions as possible. From TechnoSpark 7, it says, good day, presenter and other team member. This is a wonderful presentation. Thank you for that. Please, how can I manage my 2-year, 10-month-old daughter that tends to urinate on her dress whenever she's punished for wrong behavior? Dr. Shodende, I want you to quickly take that. How can I help a child? Anytime she's punished, she will wee on the dress. What can this do? Thank you, Blessing from Calabar.
Yeah, I think what we should consider here is that he said when the parents may think that they are justly, punishing the child justly, but there might be a perceived feeling of being punished wrongly. Maybe that's the way the child feels. Another thing is that anxiety has been created. They say punishment. The word punishment talks about anxiety. It's not every time that it is, we don't know the kind of punishment. Maybe it is beating or scolding or whatever it is. But the thing is that children are different. One child is different from the other. And the family should be able to identify what can also be, I mean, the child likes and what he doesn't like, apart from being punished, which other way can the individual be corrected in one way or the other? Sometimes you can say go to the naughty corner. It's not every time beating. So that word punishment, although except the family, talk more about it, but that's the way. Maybe the punishment is too harsh, is too much, and from the eye of the child. Thank you.
Thank you so very much, sir. Punishment connotes anxiety, fear, and a lot of other things. And that might bring that on in the child. So like you said, look for another way of correcting, discipline this child. Dr. Ijarube, this individual is asking, good afternoon, ma, please, when a child urinates at a shorter period, does it mean he or she has high threshold to urinate or low threshold? I was going to take you up on that use of threshold. Not every one of us understand threshold. All right, so does it mean this child has high or low threshold now, Dr. Jarube?
Okay, so when a child urinates more frequently, it may be that the bladder size is smaller. It may be that the tensile strength of the muscles of the bladder is also not as strong as maybe some others, so that the elasticity, what will trigger the response to want to go and urinate, comes on more frequently. Some children also have they drink a lot, and therefore they have a lot of water storage. So if the child is the type that has a lot of water in the bladder within a short time, the child will be going very frequently. One would not expect a child or an individual to go every 3 hours. That may be a bit too frequent, or every 2 hours. So why is the bladder filling so fast? Is it that the body is diuresing so fast? Is it that, somewhere the kidney is not taking back the water? Or is it that maybe there's some sugar concentration that's pulling water into the bladder? In fact, that child should be taken for medical checkup. Let them check why the child is pulling a large amount of urine within a short period. Now, you may also have children who go within a short period because maybe their bladder is just small, or maybe they are also very sensitive. So with a little pull in the bladder, they have the urge to go. It could be urinary tract infection too, because urinary tract infection will be irritating the bladder. Once there's a little water, the person feels like going quickly. So if this has always been how the child is, from the outset, we need to investigate the child. If the child was not like this before and the child is now like this now, it's even more indication that you must investigate the child. So you need to know why your child is urinating more frequently than normal, than usual. It's important.
Okay, thank you so very much, Dr. Ijarube. Uzezi, thank you. This is awesome. How can information get to the schools and parents that needs to hear about this? All right, so the recording of the webinar will be on the YouTube page of the Yaba Voice. So please, they can always access. And then we're also opening to partnering with a lot of people, just to get out there and to showcase more about these issues to the community. So if you want us to come, yes, we are willing and ready to go out there and do more of this, but then they can always access information from this webinar on the Yaba Voice YouTube page. All right, Dr. Shodende, let's look at this question from Dr. Uzoro. He said, what about playful children who carries this into his or her sleep and decide to just ease herself or himself while playing? Is this also a condition for reasons why people would also bedwet at night most often?
No, I don't understand. I didn't hear the question well.
Okay, it said, how about children who play so much? You have some very active children. And so the ball that they are playing in the daytime, they are also playing it in their dream state. And it is...
Yeah, that could also be a contributing factor. When Dr. Ijarube was talking, she said about when somebody is too playful, even while they are sleeping, they can also, because they are not really asleep, because their mind is partly awake and partly asleep. So they are in between. So they take that play even into their sleep. And therefore, they may say be doing even competition. let's see the one that your wee-wee will be too high, and in their sleep while doing that play, then they are already bedwetting. So some children carry their play, the daytime play into, in their sleep. So it could be a contributing factor.
You're not muted. Just hold on, Dr. Darube. You're not. Okay, so when you had something to that, I think it's also important that you take on this question about hereditary, about parents saying, oh, I used to bedwet a lot, and then now my child is doing it. So the link between that, enuresis and hereditary.
Okay, so for children that are actually very, very active, during the night hours, they are very tired. The muscles are tired, and so when they get that urge to go and urinate, sometimes they're just too tired, too weak, let me put it that way, to interrupt their sleep. You'll notice that many of us, when we've had a very, very tiring day, there's a way we sleep so, and then we draw saliva, which we normally will not do, and all that, because our sleep is so deep. So sometimes it's a deep sleep, and then the children don't want to interrupt that deep sleep because of the tiredness. So it will actually take some training. If you know you're going to be very active during the day, play ball and all that, you must also take the responsibility for, dragging yourself out of bed, no matter how tired, to go and urinate. You can even use the activity to do the training. So say like if you bedwet, then you will not go for that football, So if you are able to go for the football and in the night you don't bedwet, then you go for the football again. So that will encourage the child during the night to actually get up. Children may actually bedwet willingly because they are just too lazy to get up. Children may bedwet from tantrum because they want to annoy their mother, So there are so many indices like that we also need to watch out for, so that when we are going to do our intervention, we'll actually know what we're dealing with in terms of being able to know what to do to help the child. So let me look at the part of heredity. Yes, it's actually known that, especially in females, actually now even in males, that there can be disassociated family history of, males in the family, especially females, maybe because of the kind of bladder and our position of bladder and the shortness of our urethra and all that they tend to have a longer period before they can be toilet trained. So the primary enuresis tends to kind of persist for longer in some members of the family, and they may be able to identify it within females in the family, within aunties, mother, female children in the family and all that. And so those families can actually be able to point that, yes, in this family we seem to have whatever, but that should not be the narrative. The narrative should be, it seems like females in the family tend to have this issue, so that toilet training for females that are being born in that family, pay attention to it to make sure that this does not happen in this generation, that the toilet training is impeccable for those children, that you don't leave things out, you don't leave things to chance. For instance, how many of us, really go out to learn how do we toilet train our children? It's just by accident that the child eventually finds themselves dry. Most families, okay? But for this kind of people, you really want to make sure that you pay attention that they don't bedwet primarily for a very long time, because the history is there, and it may be structural in terms of their bladder size, bladder tone, and many other things like that.
Thank you so very much, Dr. Ijarupe, for that. Somebody asking about enuresis alarm, Dr. Shodeide, and he's saying, will that not cause high threshold and again cause enuresis?
No, no. Studies have shown that in fact, this kind of alarm is about 70 to 75% effective. And all over the world, depending on, maybe the volume of the alarm, it is a gentle form of alarm, not that the one that is distressing that will cause more distress. And so it has been found to be effective. and it is evidence-based. Thank you.
Thank you so very much, sir. All right, so quickly, our speakers will just talk about how can we prevent enuresis. I'm going to start with Dr. Ijarugbe. Prevention, bedwetting, 1, 2, 3 tips that people can go home with, because that is the main cause for this discussion today. What is the prevention strategy that you think people can go home with? They don't want to come to the hospital. They don't even want people outside to know. And we have said it's embarrassing, cause shame and depression, low self-esteem and other things like that. So what can they do? How can they prevent it? How can they help themselves right there when they are home? Dr. Ijarugbe, quickly.
So let's take it from the outset, step by step. So if there's a child that you're trying to toilet train, child is 5, 6 years old and is not stopping the bedwetting, it is not a show of shame. So first thing is to support that child, call that child privately and ask the child, you seem to bedwet, and all that. Let's discuss this. Is there a way you can make sure you wake up willfully at night, to go and bedwet? So show that this is not acceptable to you as a family. Some children actually think, since you are not complaining, that there's nothing wrong. Okay, so that this is not acceptable and that we want a change in behavior when you sleep at night. And that sometimes is enough for the child to be conscious enough to begin. You just see that the days of the bedwetting become more few after the discussion. Okay, another thing is to see how you can, like I said, during the toilet training, don't do it the wrong way. Don't introduce such a high threshold for the child. Let every child be able to be called from sleep. It's actually safer for the child, even in terms of life skills. The house is burning, everybody is running around. The child should be able to wake up from sound around him or her that is a bit louder than normal and run with everybody and not be left behind. A child who does not wake up until he or she is hit with heavy stuff, that is not safe for the child. So even in terms of life skill, while you're training the child, make sure that you're doing it right. If the child is persistent and has to be in school, make sure that each time this happens, you may need to call even the siblings around the child to say, I don't want you to laugh at your brother or sister. I don't want you to make jest of it. This is an off limit for all the jokes you're going to make in the house. This is not funny to us, okay? We want you to be very temperate when you come to conversations that concern this area, because it's an issue we're trying to deal with. We don't want you to mention it to outsiders and all that while we are getting our help, so that the child feels like, I'm supported. People are looking up to me and they can do this. So Dr. Schroeder, they reiterated before that there could be some form of reward, not punitive, not anger, not, you may get there and the bed is wet and you don't show all this anger and aggression, because that will put the child under tension. Just be normal. Oh, you wet your bed. How do we, dry the mattress, take things out and all that. Be very temperate with the tone of your voice, so that the child knows that this is an issue that you're dealing with. And if there are dry nights, make sure that you reward the child so that the child goes more for the acceptable behavior than the one that you're trying to change. If it's persisting, you need to get out into the hospital. You need to go look for help if it's persistent, because there may be other reasons why this is persisting. We found individuals that are coming to us at 17 because when they sleep at night, they don't, every other time they're okay. But when they sleep at night, and we found that they throw seizures at night, they have seizures during the night hours. And so the so-called enuresis will not seem to stop no matter what you're doing, because they are totally unconscious when this happens, when this phenomenon happens. So
Dr. Ijarugbe, thank you.
Thanks and all that. Thank you.
We're running out of time. Thank you so very much. I know you're loaded with lots of information. Thank you. Dr. Schroeder, the prevention in 1 minute.
Yeah, part of the prevention is to be empathic and supportive. Empathy, it talks about putting ourselves in their shoe. Many people feel that, okay, they are doing it deliberately, but we should understand that they are not doing it very deliberately. And when it happens, when talking, everything fails, we need to seek, professional attention. We should do early child toilet training. It's very important then to avoid very harsh toilet training. Thank you.
Thank you so very much. Be empathic, be supportive. All right, so the breaking news that we have for you today Can I hear a go, a room drum? Let just the beats just keep running. I have a comment. Please just send in your comments. We are not taking comments like that. Just write it there, and then I'm going to read it out. Just please, we're very sorry about that. Please just write your comments, and I'm going to read it out. Thank you so very much. All right, so we have a breaking news, and the breaking news is that Yaba Voice is 2. Yes, it's been 2 years, and we are keeping the feet. You're doing so very much. And then we have a very short clip that we want to show to you. Just a very short video is going to come up now, and we just to say, oh, thank you to everyone, and to also tell you that yes, we are doing so very well. All right, please just send in the comments about your son. Oh, we'd love to take that comment. I'm looking forward to reading that. But please just send it in, and then we'll be able to just read it to us, Dr. Patricia. I love to read that, and I think that's something that will be very helpful to everyone on this platform today. So please just send in the comments to us, and then we'll be able to do that. All right, so let's have the video.
Voice came into existence in 2020 in response to a dire need to educate members of the society on mental health issues.
The aim was to provide quality mental health information, which will bridge the gap on communication and information on pertinent mental health issues.
Invariably, this will help create more enlightenment and bring about more acceptance of mental health issues and reduce stigma.
We have been able to provide a wide range of flyers and videos on different psychological concepts ranging from coping skills for trauma, motivation, goal setting, suicidal prevention, workplace rivalry, and so on.
We have done a series of webinars which had focused on core psychological issues. Some of these include old age and loneliness, parenting in contemporary time, the stress after the trauma, bullying, spousal abuse and the psychological implications, substance addiction, anxiety, and lots more.
Realizing this has been a huge task, but we have a capable team who has made it work.
We are not resting on our powers. We are very adamant in our resolution to ensure that the goals is achieved. Happy second year of goal fulfillment to us all at Yaba Voice.
Can you just clap for us? You know, this is just very, very beautiful. And no, it comes with, we didn't have a template, we didn't have anything to run with. We just started out of the dark. And kudos to Dr. Mrs. Cecilia Ogo. She's on this call today. I would say thank you for starting that, being part of this vision. To Toby and so a lot of other people too who had here and who we started all of these things together with. Now we're still continuing. We're not resting. We're not tired. We're actually pros to do so very much for us. And if you have feedback for us, if you have comments, we'd love to hear them. We'd love to hear, we'd love to see, new areas that you want us to go into and launch into. Thank you so very much for always joining us. Yaba Voice, that is just the handle. Yaba Voice, one word on Facebook, on the Twitter, as well as on Instagram. We are there. And then on YouTube, it's Yaba Voice FNPHY. FNPHY. Yaba Voice. Okay, so the recording will be sent there, and then we have past recordings too on the YouTube page. Please subscribe to us. No, we love to just increase our subscription base too. All right, so just keep that, and then please share. Subscription is free. It's not tied to any amount or anything. It's free. So please just say, and every month we are always here. God willing, we will always here to come up with another topic. Yes, Dr. Patricia had sent a comment, and she said, I tried all measures, but eventually I had to see a consultant in Lutz. Yes, Dr. Jarugbe also mentioned it too, that if all measures, everything fails, then please take the child, because it's meant sometimes not just be psychological. There are lots of genetic issues, there are lots of other other things, no, that are tied to all of these things. And now, thank you, Naji, for saying I actually benefited from this. Oh, this gladdens our heart, because at least this is a response, this is a feedback that we want every time. So until we come your way again next month, by the grace of God, we'll be looking at something also very important. And that's the issue of physical illness and mental health. Does it have any connection? Does it have any association? When people are sick physically, is there a psychological or mentally to it? Is there a connection to it? We will look at that so that we can be more poised to be able to take care of ourselves, even when you talk about physical illness. Until we come your way again, on behalf of the medical director, Dr. Lubenga, Adekilewe, the elder clinicals, and every other member of Yaba Voice team, I want to especially say thank you to our speakers today, Dr. Ijarugbe and Dr. Shodende. Thank you so very much for being on this call. And for everyone also who had always time and again, and even if this is your first time of being on this call with us, I want to say thank you, thank you, thank you, thank you so very much. Happy anniversary to us once again. Until we come your way again. Bye-bye.